If you've noticed that your morning erections have stopped or become less frequent after age 45, I need you to pay very close attention to what I'm about to tell you. This isn't just about intimacy or your bedroom life. What I'm going to share with you today could literally save your life. Because your morning erections are actually performing a daily health check on your body, and when they stop, your body is screaming at you that something is wrong. I'm a physician who's been practicing medicine for over 2 decades, and I've seen this pattern hundreds of times. A man comes into my office complaining about erectile issues, and within 6 months to 2 years, he's back in the emergency room with a heart attack. And almost every single one of them says the same thing: "Doc, if I had known this was connected, I would have done something sooner." That's why you're watching this video right now. Because I don't want you to be one of those statistics. By the end of this video, you're going to understand exactly what's happening inside your body when morning erections stop, what it reveals about your overall health, and most critically, what you need to do about it starting today. I'm also going to give you a simple test you can do at home tonight to figure out whether you need to see a doctor immediately or if this is something you can fix yourself. So please, watch this all the way through. Your life might literally depend on it. Let me start by telling you about a patient I'll call John. He was 48 years old, successful executive, looked healthy, went to the gym 3 times a week. He came to see me because he'd noticed over the past year that he wasn't waking up with morning erections anymore. At first, he thought maybe he was just stressed from work. Maybe he was getting older. Maybe it was normal. He was embarrassed to bring it up, even to his wife. But something told him he should get it checked out, so he made an appointment. When I examined John, his blood pressure was slightly elevated at 138/88. Not terrible, but not great. His cholesterol was borderline high. His blood sugar was creeping into the pre-diabetic range. On paper, he looked like millions of other middle-aged American men. Nothing alarming. Nothing that would make you think he was in immediate danger. But I ordered some additional tests because of what he told me about his morning erections. The tests came back, and John had significant blockage in his arteries. Not enough to cause chest pain yet, but enough that he was a ticking time bomb. If he hadn't come in when he did, if he'd waited another year or 2, there's a very real chance he would have had a major heart attack. His morning erections stopping wasn't just about getting older. It was his body's way of sending out an SOS signal. And thank God he listened. Now, let me explain what morning erections actually are, because most men don't really understand the science behind them, and understanding this is crucial to understanding why they matter so much. The medical term for morning erections is nocturnal penile tumescence. I know, fancy doctor words. But here's what it actually means in plain English. Throughout the night, while you're sleeping, your body goes through different stages of sleep. One of these stages is called REM sleep, which is when you dream. And during REM sleep, something automatic happens. Your brain sends signals through your nervous system that cause increased blood flow to the penis, resulting in an erection. This happens 3 to 5 times every single night for healthy men. Each erection lasts about 25 to 35 minutes. You don't know it's happening because you're asleep. The morning erection that you might notice when you wake up is simply the last one from your final REM cycle before your alarm goes off or before you naturally wake up. Now here's the critical part that most men don't realize. These nighttime erections aren't about sex. They're not about arousal. They're not about having romantic dreams, though people joke about that. They serve a very specific, very important medical function. They're delivering oxygen and nutrients to the erectile tissue of the penis. Think about it like this. If you broke your leg and put it in a cast for 6 weeks, when that cast comes off, what happens to your leg? The muscles have atrophied. They've gotten weaker. They've shrunk. Why? Because they weren't being used. Blood wasn't flowing through them the same way. The same exact principle applies to erectile tissue. If that tissue doesn't get regular blood flow, if it doesn't get regular oxygen delivery, it starts to deteriorate. It's like any other part of your body. Use it or lose it. But here's where this becomes a matter of life and death, and why I'm so passionate about men understanding this. Morning erections are essentially a natural cardiovascular stress test that your body performs every single night. For an erection to happen, you need 4 things working perfectly. You need healthy blood vessels. You need adequate blood flow. You need properly functioning nerves. And you need balanced hormones, particularly testosterone. The blood vessels in the penis are tiny. They're 1 to 2 millimeters in diameter. Compare that to the coronary arteries that supply blood to your heart, which are 3 to 4 millimeters. That means the blood vessels in your penis are half the size or even smaller than the arteries feeding your heart. So if you're developing cardiovascular disease, if you're developing plaque buildup in your arteries, if your blood vessels are getting damaged, where do you think the problems show up first? In the smallest vessels. In the penis. This is why erectile dysfunction, and specifically the loss of morning erections, is often the very first sign of heart disease. Not chest pain. Not shortness of breath. Not feeling tired. The first symptom is erectile changes. And this doesn't happen overnight. This is usually happening 3 to 5 years before you have your first heart attack or stroke. Let me put this in perspective with some research that should make every man sit up and pay attention. A study published in the Journal of the American College of Cardiology followed thousands of men for years. What they found was shocking. Men with erectile dysfunction had a 59% higher risk of developing heart disease and a 34% higher risk of stroke compared to men without erectile dysfunction. Another study in the journal Circulation found that men who develop ED in their 40s have a 50 times higher risk of having a cardiac event in the next 10 years compared to men without ED. 50 times higher risk. Let that sink in for a moment. Your morning erections aren't just about your sex life. They're a window into what's happening in your entire cardiovascular system. They're your body's early warning system. And when that alarm goes off, you need to listen. Now, before we go further, I want to address something important, because I don't want to cause unnecessary panic. Not every change in morning erections means you're about to have a heart attack. Age does play a role. Stress plays a role. Lifestyle factors play a role. So let me walk you through what's normal versus what's a red flag. In your 20s and 30s, if you're healthy, you should be waking up with a firm erection almost every morning. Maybe not literally every single morning, but the vast majority of mornings. These erections should be firm enough that they're noticeable, sometimes even uncomfortable. This is your body at peak performance. When you hit your 40s, things start to change a bit, and this is normal aging. You might notice that morning erections aren't quite as frequent. Maybe instead of 6 or 7 mornings a week, it's 4 or 5. Maybe they're not quite as firm as they used to be. This is normal. Your testosterone levels naturally start declining about 1% per year after age 30. Your blood vessels naturally lose a bit of elasticity. These are expected changes. By your 50s and 60s, morning erections might become less frequent still. Maybe 2 or 3 times a week instead of every day. But here's the key, they should still be happening regularly. And when they do happen, they should still be reasonably firm. If you're in your 50s and you're still getting morning erections a few times a week that are firm enough to be functional, that's generally a sign that your cardiovascular system is still in decent shape. But here's what's not normal at any age. If your morning erections stop completely and suddenly. If you go from having them regularly to not having them at all over the course of just a few months. If you notice they've become so weak that they're barely there. If this happens along with other changes like difficulty maintaining erections during sexual activity, or erections that are significantly less firm than they used to be. These are red flags. Let me tell you about another patient, Michael, who was 52. Michael came to see me and said, "Doc, I haven't had a morning erection in probably 8 months. I just figured I'm getting older, you know?" My dad said the same thing happened to him in his 50s. Michael wasn't particularly worried. He thought it was just part of aging. But when I dug deeper and asked more questions, I found out that Michael was also feeling more tired than usual. He'd gained about 20 pounds in the past year. He was having trouble concentrating at work. And when he tried to be intimate with his wife, he was having difficulty maintaining erections. I ran a full panel of tests. Michael's testosterone was low, which explained some of his symptoms. But more concerning, his hemoglobin A1C, which measures average blood sugar over 3 months, showed he had developed type 2 diabetes. His cholesterol was significantly elevated. And an ultrasound of his carotid arteries showed early plaque formation. Michael wasn't just getting older. His body was breaking down, and the loss of morning erections was the first domino to fall. We started Michael on a comprehensive treatment plan. We addressed his diabetes with medication and major diet changes. We got his cholesterol under control. We started him on testosterone replacement because his levels were genuinely low. And within 6 months, Michael had lost 30 pounds, his energy was back, and yes, his morning erections had returned. More importantly, we potentially prevented him from having a stroke or heart attack in the next few years. This is what I want you to understand. Morning erections are a vital sign. They're as important as your blood pressure, your heart rate, your cholesterol levels. They're telling you something about what's happening inside your body. And when they stop, you need to figure out why. So what actually causes morning erections to stop? Let me break down the most common culprits, And I'll go from the most common to the most serious. The first and probably most common cause in modern life is chronic stress and poor sleep. Remember, morning erections happen during REM sleep. If you're not getting enough deep, quality sleep, you're not going through enough REM cycles. If you're stressed to the point where your cortisol levels are constantly elevated, it suppresses testosterone production and interferes with normal sexual function. If you're only sleeping 5 or 6 hours a night, if you're waking up multiple times, if you're stressed about work or finances or relationships, this can absolutely affect your morning erections. The good news is this cause is usually reversible. If you improve your sleep and manage your stress, morning erections typically come back within a few weeks to a couple of months. But here's the problem. Most men use this as an excuse. They assume stress is the reason without actually investigating further. Don't make that mistake. Get it checked out even if you think stress is the cause, because stress might be part of it, but it's rarely the only factor. The second major cause is low testosterone. Testosterone is the primary male sex hormone, and it plays a crucial role in sexual function, including morning erections. After age 30, testosterone naturally declines by about 1% per year. But some men experience a much steeper decline, which we call hypogonadism or low T. By your 40s and 50s, if your testosterone has dropped significantly, one of the first signs is a reduction or loss of morning erections. Low testosterone also comes with other symptoms. Decreased energy and fatigue. Loss of muscle mass and increased body fat, especially around the belly. Mood changes like irritability or depression. Reduced motivation and drive. Difficulty concentrating. If you're experiencing several of these symptoms along with loss of morning erections, low testosterone is very likely part of the picture. The good news is that low testosterone is diagnosable with a simple blood test, and it's treatable. Testosterone replacement therapy, when done properly under medical supervision, can restore normal levels and bring back morning erections. But you need to be evaluated properly because testosterone replacement isn't right for everyone, and it does come with potential risks if not monitored correctly. The third cause, and this is a big one, is medications. There are dozens of commonly prescribed medications that can interfere with erectile function and morning erections. At the top of the list are antidepressants, particularly SSRIs like Prozac, Zoloft, and Lexapro. These medications are incredibly helpful for depression and anxiety, but sexual side effects, including loss of morning erections, are extremely common. Some studies suggest up to 70% of men on SSRIs experience some degree of sexual dysfunction. Blood pressure medications are another major culprit, especially beta blockers and some diuretics. These medications are important for controlling blood pressure and preventing heart attacks and strokes, but they can reduce blood flow and interfere with the mechanisms needed for erections. Other medications that commonly affect morning erections include certain prostate medications like finasteride, which is used for enlarged prostate and hair loss. Anti-anxiety medications like benzodiazepines. Some medications for heartburn and acid reflux. Even antihistamines that you take for allergies can have an effect in some men. If you started a new medication within the past year and noticed your morning erections decreased or stopped around the same time, that medication is very likely the cause. Don't stop taking your medication without talking to your doctor, but absolutely bring this up. There are often alternative medications that don't have the same sexual side effects, or your doctor can adjust your dosage or add another medication to counteract the side effects. Now we get to the more serious causes, and this is where you need to pay very close attention. The fourth major cause is cardiovascular disease, and this is the one that terrifies me as a physician because it's so common and so dangerous. Atherosclerosis, which is the buildup of plaque in your arteries, doesn't happen overnight. It's a gradual process that starts in your 30s and 40s for most men, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, smoking, or a family history of heart disease. As plaque builds up in your arteries, blood flow becomes restricted. And remember what I said earlier, the blood vessels in the penis are the smallest in your body. So they're affected first. You might not have any chest pain. You might not feel short of breath. Your heart might seem perfectly fine. But your morning erections stop because those tiny blood vessels can't get enough blood flow anymore. This is why loss of morning erections is considered a predictor of future cardiovascular events. Your body is giving you advanced warning that your vascular system is compromised. If you ignore this warning and don't address the underlying cardiovascular issues, you're at significantly increased risk of heart attack and stroke. The fifth major cause is diabetes, and diabetes is absolutely epidemic in men over 40. About 25% of men over 45 have type 2 diabetes, and another 35% have prediabetes. Diabetes damages blood vessels and nerves throughout your entire body. It accelerates atherosclerosis. It damages the tiny nerves that control erections. It reduces nitric oxide production, which is essential for blood vessels to dilate and allow blood flow. Men with diabetes are 3 times more likely to have erectile dysfunction than men without diabetes. And often, erectile changes including loss of morning erections are one of the first signs that your blood sugar is out of control. If you're overweight, if you're not active, if you have a family history of diabetes, and your morning erections have stopped, there's a very real possibility that diabetes or prediabetes is the underlying cause. The 6th cause is sleep apnea, and this one often flies under the radar. Sleep apnea is a condition where you stop breathing repeatedly throughout the night. Your airway collapses, you stop breathing for 10, 20, sometimes 30 seconds or more, your oxygen levels drop, and then you gasp and start breathing again. This can happen dozens or even hundreds of times per night. Sleep apnea destroys sleep quality because you never get into deep, restorative REM sleep. And remember, morning erections happen during REM sleep. No REM sleep means no morning erections. But sleep apnea also damages your cardiovascular system. The repeated drops in oxygen and spikes in blood pressure cause massive stress on your heart and blood vessels. Sleep apnea significantly increases your risk of heart attack, stroke, and sudden cardiac death. If you snore loudly, if your partner has noticed you stop breathing during sleep, if you wake up gasping or choking, if you wake up with headaches, if you're always tired no matter how much you sleep, you very likely have sleep apnea. And treating sleep apnea with a CPAP machine not only brings back morning erections in many men, it also dramatically reduces your cardiovascular risk. The 7th cause is obesity and metabolic syndrome. When you carry excess weight, especially around your belly, it's not just cosmetic. That visceral fat around your organs is metabolically active. It produces inflammatory chemicals. It lowers testosterone. It increases estrogen. It contributes to insulin resistance, which leads to diabetes. It raises blood pressure and cholesterol. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, excess belly fat, and abnormal cholesterol levels. And when you have metabolic syndrome, your risk of heart disease, stroke, and diabetes skyrockets. One of the early manifestations is erectile dysfunction and loss of morning erections. The good news is that weight loss, especially if combined with exercise, can reverse metabolic syndrome and restore normal erectile function. I've seen it happen countless times. A man loses 30, 40, 50 pounds, starts exercising regularly, and his morning erections come back. It's not magic. It's biology. You've improved your vascular health, increased your testosterone, reduced inflammation, and your body starts working the way it's supposed to. Now, I also need to address a couple of less common but important causes. Neurological conditions can affect morning erections. Things like multiple sclerosis, Parkinson's disease, spinal cord injuries, or nerve damage from surgeries can interfere with the nerve signals necessary for erections. If you have any known neurological condition or have had surgery in the pelvic area, this could be a factor. Hormonal imbalances beyond just low testosterone can also play a role. Thyroid problems, either hyperthyroidism or hypothyroidism, can affect sexual function. Elevated prolactin levels, which can be caused by certain medications or pituitary tumors, can suppress testosterone and cause erectile issues. These are less common, but they're worth investigating if the more common causes have been ruled out. And finally, I need to mention psychological factors, though I want to be very clear about this. For decades, doctors blamed erectile problems on being in your head or psychological issues. We now know that the vast majority of erectile dysfunction, especially in men over 40, has a physical cause. However, psychological factors can contribute. Severe depression, anxiety disorders, relationship problems, and past trauma can all affect sexual function, including morning erections, but here's the important distinction. If you can still achieve firm erections during sexual activity, or if you notice morning erections occasionally but they're inconsistent, psychological factors might be playing a bigger role. But if you have no morning erections, no spontaneous erections during the day, and difficulty with erections across all situations, it's almost certainly a physical issue, not a psychological one. Now let me give you the home test I promised earlier. This is something you can do tonight to help determine whether your problem is primarily physical or psychological, and whether you need to see a doctor urgently. It's called the stamp test, and it's been used by doctors for decades as a simple screening tool. Here's how it works. Tonight before you go to bed, take a roll of postage stamps. Not the self-adhesive kind, but the old-fashioned kind that you have to lick. You need about 6 or 7 stamps connected together. Wrap the strip of stamps around the base of your penis while it's flaccid, overlapping the edges slightly so they stick together, forming a ring. Make it snug but not tight. Then go to sleep as normal. If you have normal nocturnal erections during the night, the stamps will break at the perforations because of the expansion. In the morning, check the stamps. If the stamps are broken, it means you had erections during the night. This suggests that the physical mechanisms for erections are working fine, and your issues might be more related to stress, anxiety, or psychological factors during waking hours. If the stamps are intact in the morning, it suggests you're not having nighttime erections, which points toward a physical cause. Now, this test isn't perfect. You might not have had any REM cycles that particular night. You might need to try it for 3 or 4 nights to get a reliable result. But it's a useful starting point. There's also a more sophisticated version of this you can buy called a Rigi scan or nocturnal penile tumescence testing device, but honestly, the stamp test gives you enough information to know whether you need to pursue further evaluation. So when should you actually worry? When should you make an appointment with your doctor right away instead of trying to fix things on your own? Let me give you clear guidelines. You should see a doctor immediately if morning erections stopped suddenly, especially if it happened over just a few weeks or months. If you're also experiencing chest pain, shortness of breath, or other cardiovascular symptoms. If you have diabetes and your morning erections have stopped. If you're taking multiple medications and you're not sure which one might be causing the problem. If you've tried improving your sleep, reducing stress, losing weight, and exercising more for 3 to 6 months and nothing has changed. If you're under 50 and you've noticed a significant decrease or complete loss of morning erections.
You should also see a doctor, though perhaps less urgently, if this has been gradually happening over several years and you're not sure what's causing it. If you have risk factors for heart disease like high blood pressure, high cholesterol, smoking, or family history. If you're overweight and have symptoms of diabetes like increased thirst, frequent urination, or unexplained weight loss. If you're experiencing other symptoms like extreme fatigue, mood changes, or loss of muscle mass that suggest low testosterone. When you see your doctor, here's what you should expect. A good doctor will take this seriously and do a comprehensive evaluation. They should take a detailed medical history, asking about your symptoms, when they started, other health conditions, medications you're taking, lifestyle factors like sleep, stress, diet, and exercise. They should do a physical exam, checking your blood pressure, listening to your heart, examining your abdomen, and yes, examining your genitals to look for any anatomical issues. They should order blood tests including a complete metabolic panel to check kidney and liver function, a lipid panel for cholesterol, hemoglobin A1C to check for diabetes, a testosterone level, and possibly thyroid function tests and prolactin levels. They might also recommend additional tests depending on your symptoms and risk factors. This could include a cardiovascular workup with an EKG or stress test, an ultrasound to look at blood flow in the penis, a sleep study if they suspect sleep apnea, or referral to a specialist like a urologist, endocrinologist, or cardiologist. Now let me talk about what you can do starting today to improve your morning erections and your overall cardiovascular health, because in many cases, lifestyle changes can make a dramatic difference. First and most important, prioritize your sleep. Aim for 7 to 9 hours of quality sleep every night. Create a consistent sleep schedule, going to bed and waking up at the same time every day, even on weekends. Make your bedroom dark, quiet, and cool. Limit screen time for at least an hour before bed because blue light from phones and computers suppresses melatonin production. Avoid caffeine after 2 p.m. and limit alcohol, especially close to bedtime, because while alcohol might help you fall asleep, it disrupts REM sleep. Second, manage your stress. I know this is easier said than done, but chronic stress is absolutely toxic to your sexual health and your cardiovascular health. Find stress management techniques that work for you. This might be meditation, deep breathing exercises, yoga, spending time in nature, or talking with a therapist. Exercise is also one of the best stress relievers. Even just 20 to 30 minutes of moderate exercise most days of the week can significantly reduce cortisol levels and improve your mood. Third, lose weight if you're overweight. I'm not talking about crash diets or extreme measures. Even losing 5 to 10% of your body weight can dramatically improve your metabolic health, increase testosterone, reduce inflammation, and improve blood flow. Focus on eating whole, unprocessed foods. Lots of vegetables, fruits, lean proteins, healthy fats, and whole grains. Limit sugar, refined carbohydrates, and processed foods. Fourth, exercise regularly. Cardiovascular exercise like brisk walking, jogging, cycling, or swimming improves circulation, strengthens your heart, and helps maintain healthy blood vessels. Resistance training and strength training boost testosterone levels naturally. Aim for at least 150 minutes of moderate intensity cardio per week, plus 2 or 3 strength training sessions. Fifth, quit smoking if you smoke. Smoking is absolutely devastating to your vascular health. It damages the lining of your blood vessels, reduces blood flow, accelerates atherosclerosis, and directly causes erectile dysfunction. If you quit smoking, you can see improvements in erectile function within just a few weeks to months as your blood vessels start to heal. Sixth, limit alcohol. Moderate alcohol consumption, meaning no more than 1 or 2 drinks per day, probably won't cause problems. But excessive drinking absolutely will. Alcohol suppresses testosterone, damages the liver which then can't metabolize estrogen properly, and chronic heavy drinking damages blood vessels and nerves. Seventh, monitor your blood pressure and blood sugar. If you don't know these numbers, you need to find out. High blood pressure and elevated blood sugar damage your blood vessels silently for years before you have any symptoms. If your numbers are elevated, work with your doctor to get them under control through lifestyle changes and medication if necessary. Eighth, consider supplements, but be smart about them. There's a lot of snake oil out there promising to cure erectile dysfunction. Most supplements don't work, but there are a few that have actual scientific evidence supporting them. L-arginine is an amino acid that your body converts to nitric oxide, which helps blood vessels dilate. Some studies show it can improve erectile function, especially when combined with pycnogenol. DHEA is a hormone precursor that can boost testosterone in men with low levels. Ginseng, particularly Korean red ginseng, has some evidence supporting its use for erectile function. But talk to your doctor before starting any supplements, especially if you're on other medications. And finally, maintain a healthy relationship and open communication with your partner if you're in a relationship. Sexual health isn't just physical. Emotional intimacy, communication, and connection all play important roles. If you're having issues, talk about them openly with your partner rather than withdrawing or avoiding intimacy altogether. Let me come back to where we started, because I want to make sure this message really lands. Morning erections are not just about sex. They're a vital sign. They're your body's way of telling you whether your cardiovascular system is healthy or whether there are problems brewing beneath the surface. If your morning erections have stopped or significantly decreased, please don't ignore it. Don't write it off as just getting older. Don't be embarrassed to talk to your doctor about it. This could be the early warning that saves your life. Remember my patient John who came in when his morning erections stopped and we discovered he had significant arterial blockage? If he had waited, if he had been too embarrassed to bring it up, there's a very real chance he would have had a major heart attack. On the flip side, remember Michael, whose loss of morning erections led us to discover his diabetes, low testosterone, and cardiovascular problems? We addressed all of those issues, and within 6 months he felt like a different person. More energy, better mood, better health, and yes, his morning erections came back. Your body is talking to you. The question is, are you listening? If you're watching this video because you've noticed changes in your morning erections, you've already taken the first step by seeking information. Now take the second step. Do the stamp test I described to get an initial sense of what's going on. Make an appointment with your doctor and have an honest conversation about what you're experiencing. Get the blood work done. Get evaluated properly. And while you're waiting for that appointment, start making the lifestyle changes I talked about. Improve your sleep. Manage your stress. Clean up your diet. Start exercising. Lose some weight if you need to. These changes will benefit your health regardless of what's causing your symptoms, and in many cases, they might be enough to bring back your morning erections on their own. I want to leave you with this final thought. Your health is not something you can afford to gamble with. You only get one body, one life. Taking care of yourself isn't selfish, it's necessary. The men who live long, healthy, vibrant lives into their 70s, 80s, and beyond are the ones who pay attention to the warning signs and take action before small problems become big problems. If you found this information helpful, please share this video with other men in your life. Share it with your brothers, your friends, your father. This is information that every man over 40 needs to know, but that most men are too embarrassed to talk about. By sharing this, you might save someone's life. Thank you for watching, and take care of yourself. Your health matters. You matter, and your body is trying to help you by sending these signals. Listen to it.